This segment sponsored by Femme Medical and Spa. Welcome back. If you're just joining me, I am here at Femme Medical and Spa, and I'm joined by their founder, Dr. Ashley Scott. Hey there.
Hello.
Okay, so we're having so much fun just learning more about your new facility that will be opening up soon, which is exciting, and also learning about your treatment.
Yes.
So what will we explore first?
So first I want to take you to our EmSculpt Neo device. So it's great for burning fat and building muscle. So anyone who has like any stubborn areas anywhere on their body, really, you can utilize our device and get that desired outcome you're looking for.
All right, let's give it a try. Okay, Dr. Ashley, we're in this room, and so walk us through.
So we have Sakia and Sydney here. They're performing an EmSculpt Neo procedure on this patient. So this is to help burn any of that visceral fat that's deep. It also helps to tighten your muscles and does skin tightening as well. 30 minutes on this machine is equivalent to 22,000 sit-ups.
Wow.
In addition to every treatment area, you're losing 30% of the fat in that area and gaining 25% muscle. So I often tell patients 4 to 6 treatments of this is equivalent to 12 to 16 weeks of high intensity interval training.
Wow.
So very good results with this.
Okay, awesome. Let's see how it works.
So yes, they'll just place the applicator underneath these bands. They place it really snug against the patient's skin. You want to make sure it's flush against the patient's skin. And the patient just lays there. So this is so much better than going to the gym and doing those 20,000 sit-ups. And that's it. You turn the device on and we just start to ramp it up. Go ahead.
All right, doctor.
Okay, are you ready?
I am. Okay, so I have something in my hand.
So that's just our little panic button. So if you started to notice that things were more intense than what you felt like you can tolerate, you just press that and it'll stop it.
Okay.
But we'll start really light with you, and
Okay.
then we can grade up the intensity as you feel it's appropriate.
All right, I'm excited to see what this feels like. You say, wait, 20,000 sit-ups?
20,000 sit-ups in 30 minutes. Yes.
Ooh.
You feeling it?
Yeah, it's nice. It's a warm sensation.
So there's electromagnetic energy that is causing what we call super maximal contractions. So it is the most that any muscle can contract at any given time. And you're also getting some heat, radio frequency heat. And so together, that's what's causing all of that fat to melt away. It's increasing the strength and building up muscle for you, and also tightening the skin.
Okay.
Yeah.
That's exciting.
So we can always take it up if you want us to take it up.
Take it up.
Take it up.
Yes. And one thing that you said that stood out is that this is a procedure that people can get in between, like on their lunch break. It's something that doesn't require downtime.
Right. So that's another reason why I love this device, because it's quick, it's easy. You know, you're going to be able to get this in, and then you go home after work. You don't have to do your workout because we've already done it for you.
Oh.
So.
All right, I just finished my treatment.
And what did you think?
Okay, so it was very easy to do. Like, I honestly felt like I wasn't doing any work.
Exactly. That's the beauty of it.
The machine was doing it. It felt warm. It was fully heated. It was vibrating, pulsating, and I made it up, I think, to the highest level, right?
You did, and you completed the full therapy on the highest level, so good for you.
All right.
Yes.
Ooh, it was really good. So now I'm excited. I just completed 20,000 sit-ups.
20,000 sit-ups in 30 minutes. You're good to go.
Okay, yeah, I love it. I'll definitely do this again. You say you can do it once a week 4 treatments.
Four treatments, and then we obviously want you to come back for maintenance treatments every few months or so, just to maintain that built up muscle that you've already built.
All right, EmSculpt Neo. All right, on to the next.
Okay.
Hello. All right, so what do we have here?
Yes, so here we have Marita. She's getting an M-Face procedure. And this is Drew and Taylor. They're going to be assisting us today. So M-Face is a device very similar to the EmSculpt, but for the face. So we have applicators that you can place on your forehead, your cheeks, under the eyes, under the submentum. And the goal of this treatment is like a needleless facelift. So it will tighten the skin, it will take away those fine lines and wrinkles, it helps to build collagen and elasticity, so it gives you that more radiant, youthful appearance.
Okay, which is so important.
Yes.
Okay, how exciting. Okay, so just walk me through, so after the paddles go on, what is the sensation that the patient will be feeling?
So it's almost as if you're just cheesing and relaxing. So if you practice that, it's just a tightening of these muscles. So there is no pain associated with this at all. You just feel like your muscles are just squeezing a little bit.
Okay, so all this time I thought that smiling big was giving me crow's feet, but it's actually good, right?
Yes, you want to keep doing that motion, but you know, if you are noticing crow's feet, come and we'll put a pad on and we'll take it away for you.
Okay, I love it. And then what is the frequency that someone should do this procedure?
So you can do this treatment once every week or 2 weeks or so, depending on, you know, we usually say the number of treatments depends on how many decades that you have been with us. And once you've completed your full treatment course, then you'd still want to do some maintenance therapy every few months or so. And then you also want to make sure you're maintaining a good skincare regimen as well.
Okay, and what is the main takeaway from this? Like, what is the difference in skin that the patient will see after this machine?
So I love this machine in particular for women who are, you know, going through that menopausal transition or who have just lost a significant amount of weight. You know, you can lose some of that definition, so you'll get a more contoured appearance in your face. It'll leave that skin feeling more radiant, more hydrated as well. But you don't have any downtime.
Okay.
Yeah.
I love that. And you said something important, collagen.
Yes.
That's something that we need.
Yes, you need that collagen to build you that structure into your face. And so as we get older, we lose a lot of that. We're actually starting to lose it as early as our 20s. So doing these procedures is great for prevention and maintenance.
Okay, and how long does this procedure take?
So this procedure is about 20 to 30 minutes, depending on where you're placing the applicators.
All right, awesome. On to the next. Okay, so we were back in the beautiful floral wall room. And you have a special chair here that is part of this EmSculpt, chain. So tell me about it.
Yes, so this is the EmSella Chair, and this is really why I fell in love with all things aesthetics, essentially. So urinary incontinence affects about 1 in 4 women, and it's especially notable after pregnancy or in that menopausal transition. But men also are affected by urinary incontinence as well.
So what is that?
So that is when there is leakage of urine that is involuntary.
Oh.
Yes, so you can treat that with medication, with surgery, or now you can treat it with a chair, which is wonderful.
Yeah.
So 28 minutes in this chair is equivalent to 11,400 Kegel exercises.
Oh, the Kegel. Okay, got it.
So as a gynecologist, I am always encouraging my patients and reminding them, don't forget to do your Kegels. And a lot of times we're gonna forget, right?
Yeah.
And usually I only ask them to do about 30 a day.
Okay.
So, if you can't remember to do that, it's kind of like, you're messing up your pelvic floor. And so the beauty of this chair is, okay, well, you don't have to worry about it anymore. let the chair do it for you.
Yes.
You sit in it fully clothed, it's pain-free, and 28 minutes, you've done what we've been asking you to do for years.
Right.
In 28 minutes, so.
Yes,
yeah.
and so just in your professional advice, you say people should do like 30 a day, but what age should they really start to focus on making sure that they're practicing this?
So I usually tell patients, once you are like in that childbearing age, or once you've had your first baby, whether it is vaginal or C-section, your pelvic floor is starting to become impacted.
Okay.
So usually, you know, I'm encouraging patients to squeeze, hold it for 10 seconds, and then relax.
Okay.
And it doesn't have to be all at once. You can spread them out throughout the day. But, you know, it's something that if you're not already in the habit of doing, it's very difficult to get into that habit. So.
Okay, and so and for the Kegel, for people who don't know, like you said, is a process of squeezing in our vaginal area.
Yes.
Okay.
So you squeeze. I usually tell patients, imagine you need to go pee and you need to hold it. How would you do that?
Okay.
So if you are having a hard time activating those muscles, that's what you want to think about. But, you know, even as you squeeze, your muscle immediately starts to weaken.
Okay.
Because you only have so much control over that muscle. But the beauty of this chair is that it gives you what we call those super maximal contractions. So it can give you the most squeeze that a muscle can do at any given time, and it can sustain that.
Okay.
So it really helps to tighten that pelvic floor.
Okay. All right. Well, I'm going to give it a try. You already know, and let you know what it feels like to do this ultra Kegel machine. Okay.
Yes. And David, our nurse practitioner, he's going to get the machine going for you. Yeah, you see the chair starting to light up there. So 95% of patients who experience this chair report a significant improvement in their urinary incontinence.
All right, that was very interesting. Like it seems so easy.
It is really just that easy.
Yeah, just light vibrations. It wasn't uncomfortable at all.
Nope. And so I think anyone can come in here and sit in this chair, and it is life-changing, truly.
Yeah. Well, awesome. Well, thanks for giving me a sneak peek
of
the services.
So appreciative that you stopped by, and we look forward to, you know, you bringing your friends back.
Yes, because there's so many opportunities. So first off, right now you are accepting appointments.
Yes, we
which
are.
Is exciting.
So patients can go to our website and schedule, and if they can't get through there, they can call us here at the office.
Okay, and then you officially start seeing patients on June 2nd.
June 2nd.
Yes, but we have to tell people about the special grand opening party that you're going to have.
So we are hosting an open house event on May 22nd. Patients can come in, they can demo all of the devices that you tried today, and we have other ones that they can try as well. We're doing special promotional pricing for our packages. We're giving out refreshments, we're doing giveaways, and we are giving one lucky guest that day a free package of all of the services.
Wow.
So, yes, you don't want to miss it.
Don't want to miss it. Okay, well, awesome. And if you would like more information about Femme Medical and Spa, we'll have their website listed below. And don't forget to check them out at their open house. That's this Thursday, May 22nd. We'll have their website listed below. You can come and enjoy a demo of their different products and also make an appointment. And thank you so much for tuning in today. We hope you enjoyed the show. And remember, you can always catch up on episodes and segments of Living Local 15 by going to WANE.com, downloading the WANE app, and also checking us out on YouTube. And I'll leave you with this. It's never too late to live your best life, so start living it today. And I look forward to seeing you here tomorrow. Bye-bye. This segment sponsored by Femme Medical and Spa.